I'm legitimately excited to talk with you guys about this subject today because psychedelics in mental health care is such a legitimately interesting topic. And part of what's interesting about it actually is that it has less overlap with addiction than you might think. These are substances that are, you could call it intoxicating or impairing in nature. They have acute effects, but they actually don't, for most cases, and we'll talk about where it is the case, but in most cases they aren't addictive in the traditional chemical dependency sense, even though they certainly can be misused and can be used as a form of escapism. The reason why I have taken an interest in this subject in particular is that as an addiction psychologist and working with people primarily who are struggling with addiction, I very commonly see this overlap between industry and addiction, in that people are out there selling you these products. And in many ways, on the addiction side of the street, they make more money if they get you hooked on it. And so I've always been very interested in looking at how does money, how do politics, how do corporations and business impact our public understanding of addiction, and ultimately how many people struggle in these ways. And so psychedelics are a bit different because they we'll talk a little bit about history, although I'm actually less interested in history and more on what's going on right now. Um, but they've got a history being seen more as like a drug of misuse. And that's part of how they landed in Schedule 1, which means high addiction potential and no medical role, essentially. And so that's where it sat for a while. And in recent times, we've started to see things shift, both in terms of the research side of things, but then also again in terms of the industry side of things. And so you start to see headlines kind of like this. Let me see if I can get the slide to move. You ever have those times when you like press the, there we go. Okay. So you'll see headlines like this, right? Like psychedelics are having a moment, and it could be women who benefit, and do psychedelics have a future in sports on the front of Sports Illustrated, and 65% of Americans with mental health conditions want access. You have all these articles about investors pouring in, Elon Musk talking about it. And at the core of it all is actually, in my experience, a fundamental confusion and misunderstanding about what's really going on with all of this. Like, what is the paradigm? What is it not? What can they do? What can't they do? And that's actually why what we're starting to see, if you are looking in actual medical journals, is you start to see the most foremost researchers in psychedelic science talking about the bursting of the psychedelic hype bubble and why this is such a big deal. This is, the author here, not first author, but oftentimes the last is the one who oversees it. He's the director at Johns Hopkins Center for Psychedelic Studies. But the idea here being that there's the way that new products, technologies, and things, what it tends to go through is you've got a technology trigger, and then you hit this peak of inflated expectations. But then when you overpromise and underdeliver, things go down again before they then eventually can get back up. And part of the problem is that this part here is essentially what knocked psychedelic research out about 40 or 50 years ago, is where it got lumped in with some other substances. There were some adverse events that occurred, and policies changed, and it put a stop to it. And so what we're seeing right now is the people who are doing the research are saying what we're seeing right now is actually really promising and is really interesting. And we are going to talk about that over the course of the day today. But let's not get too far ahead of ourselves. Why don't we let good science lead the way? And so ultimately, what I hope to talk about with you guys today, we're going to try to cover a lot of ground. This is actually not, this is material that I made just for us today. This is something that I have not spoken on prior to working with you guys today. So hopefully we'll be able to get through all of it without running late, or I suppose running too early, but I doubt that'll be the case because there's so much to talk about. What we're going to start with is what psychedelics are. And so we'll get into this in just a second. We're then going to talk a bit about the research that we've seen so far in this modern age of research and what that looks like. I'm going to walk you through one of the published clinical protocols, overview, because it's about 100 pages long, but to really talk about what MDMA assisted psychotherapy for trauma looks like. And then end with the distribution system, which is, again, part of what drew me into it, is talking about, so what's going on with all of this in terms of corporate investments and the hype and the media versus the science, because there's actually several distinct arms of how this is proceeding right now that in many ways are in conflict with each other. And, the question of how is this all going to end up, I think, is very much still up for debate. And I'm not sure exactly what will shape it, but it's occurring in front of our eyes. But all right, so let's start just with the basics about what are psychedelics. And this is one of the, just from jump, one of the confusing aspects about this, because psychedelics actually are a very broad class of substances. What we're going to talk about quite a few of them today, but it's not like even necessarily that they all act in similar ways. Like SSRIs, for example, work selectively on serotonin, even if there's different particular serotonin receptors that they get at, and they've got different chemical footprints. It's all kind of about the same. Psychedelics actually have several different classes, and even within those classes, there's a lot of differences. They do, however, impact primarily on serotonergic and dopaminergic pathways. So dopamine, from the icebreaker there, and also serotonin, and do a lot of things. They actually change the way your brain talks to itself, the way it connects. And what that does is between that and the impact of the chemicals themselves can produce hallucinogenic, in terms of seeing and hearing things, spiritual, euphoric states. And we'll talk more about specifically what that looks like as we go along. But it creates this lots of sensory and even sometimes subjectively extrasensory sort of perceptions. They have plant-based psychedelics in particular have a long history of religious use in different cultures. The synthetic ones were produced more recently, most of these in the 1900s. But there's actually over 200 psychedelic compounds that have been identified right now. And again, that's part of where things start to get difficult and confusing in terms of, so like, how is this being studied? What are we picking to study first? And why? I mean, there's a lot that still is not known, and we'll talk a lot more about what is known and is not known as we go along. There was actually very active research between 1950 and 1970 in particular. And if you've watched or read anything about the history of psychedelics, you'll hear names like the Shulgins and Timothy Leary, and different folks had different approaches or different substances that they focused on. But there was research going on. It didn't reach that critical mass, though, to the point where it was meeting, say, for example, FDA type approval to be used as a medicine, but it was being used recreationally a lot. And that's part of what led it to being put into Schedule I back in 1970. And that really, there were a couple of different drug control related acts that put the kibosh on the research, essentially. And so it was left very much untouched due to these regulations for several decades. And what we are in right now is what's being called colloquially a psychedelic renaissance, where in the past 15 to 20 years, we've seen a lot more activity around researching this class of substances. And this is a nice graphic from a literature review from last year that looks at the non-clinical research studies as well as clinical trials over the years. And there's a few elements of this graph that I think are worth highlighting. The first is, as you can see, again, as of 30 years ago, zero, nothing. And look at this rapid acceleration, right? Particularly in the last 10 to 12 years. That being said, what this number represents, these aren't the number of studies, these are the number of participants. And that's really important because actually, if you look at the number of participants in this 5-year span, there's actually only 1,300, and the bulk of them are still not in clinical trials. And that's really important in terms of the sorts of conclusions we draw and how quickly we push things out and how confident we are in that. You can see that the amount of clinical trials is also growing. And again, you can see this very large jump between that 2011 to 2015 block and the 2016 to 2021. But even all that said, if you add all this up, we have definitely had fewer than 400, certainly maybe even fewer than 300 participants total across all clinical trials. And that has implications in part also in terms of whether or not they have what's called sufficient statistical power to even make solid inferences in some cases. Now, again, I wouldn't necessarily say that that means we shouldn't be taking these studies seriously. We should. And we'll talk about the really promising data that's out there. But as the researchers themselves will be the first to say, it is so important actually that these studies are replicated and increased, and we get more of this in place. And that's part of what's needed to really push this sort of thing forward. This research is being done in a lot of different places. This is not like back alley sort of stuff. There's a lot of hubs for this in very well-respected institutions. Places like Johns Hopkins, Yale, UC Berkeley, Wisconsin-Madison, Sinai Icahn School of Medicine, Columbia. So this is really good, solid people and research just on smaller scales. And so that's one side of what's going on. And in truth, that's most of what we are going to talk about today is what's going on in those places. Because as a psychologist myself, who cares very much about research, that's where I put most of my eggs. Like when I think about like where am I going to trust information? Am I going to trust it from people who are making money off of you believing what they say? Am I going to trust what I read on Reddit from people who are sharing their anecdotal experiences? Or am I going to read peer-reviewed research in respected journals? That's where I go to. And there will be a lot of those studies that we're going to go through today that you're welcome to either grab yourself or because I'll have the citations there. Or if you need help looking at them, I'm happy to send them to you. But operating in parallel, we also have a tremendous amount of venture capital. And I alluded to that on that first slide there. How there's a lot of money coming into space. And if you go to Psychedelic Alpha, this is a group that tracks what's going on in the industry in a lot of different layers. These are all the companies right now that are doing psychedelic drug development. So this is not necessarily as deep clinical testing, although some of them do it, but they're trying to create and then patent compounds to make money off of this. And that again, and it's important, right? That's part of the whole process. Someone does have to produce it. And when there are so many psychedelic compounds right now, as well as certainly plenty that probably haven't been discovered yet synthetically, this is a lot of undiscovered terrain. And so there's a lot of investors right now who are seeing a potential, like basically psychedelic gold rush, where if you can find the ones that work the best, that have the most efficacy, or get patents on certain procedures, because that's part of this too, as we'll discuss, the way you use psychedelics in conjunction with therapy is very different than the way you would have other medications, say, enhance the treatment process, like a SSRI. That's something people take in the background rather than in front of you in some way. So there's a lot of money out there and people are scrambling to try to get their hands on it. Then another realm of this is that we have, which you may have heard about in Oregon as the one that's closest to actually doing this, but then also most recently in Colorado, actually legalizing what are called healing centers, which are doing something completely different. This is akin to how there are cannabinoid-based pharmaceuticals that you can get, like Epidiolex is one, Sativex is going through clinical trials, Marinol is one that we've had for a long time, that you get from pharmacies, because those are, like what we traditionally think of as medicine. And then you have cannabis dispensaries, marijuana dispensaries, doing something very different. And this is actually very similar, where and you can see these are the two states that have done it so far, but then all of these ones that are different shades, that light blue, have active legislation. I'm based out of Chicago, and my state is one where there's now a bill out there saying we want to open psychedelic healing centers, essentially. And as we're going to talk about, again, as someone who cares very much about science and medicine, and who actually even sees a lot of potential in what's going on in the research side of this is a very concerning trend, in my opinion. And we'll talk more about why, and why actually this movement that you're seeing right here works counter to what a lot of these people are so diligently and importantly doing in research institutions. And then there's even more aspects to this rollout that we'll talk about as we go along. But people are getting very excited. And in that excitement, sometimes that means that you can get ahead of yourself and potentially, and again, this is what's being written about, you go too quickly, you run the risk of a lot of lost opportunity in terms of the ability to help people as opposed to the ability to generate capital. So, all right, let's zoom back in. Let's narrow our scope down from the national level to the molecular level and talk a little bit about what these substances are. Again, there are a lot of different psychedelic compounds that we could talk about. A lot of the major ones are represented on this slide, but they are broken into primarily into two groups. One are tryptamines, and this is basically ones that are related to serotonin. That is their primary mechanism of action. That includes psilocybin or magic mushrooms, which we'll talk about. That includes DMT or ayahuasca, which we'll talk a little bit about. That includes LSD, which we'll talk a little bit more about today as well. And then the second category are phenethylamines. And those operate, it's not that they don't impact serotonin at all, but these are the ones that are more related to the dopamine molecule. You can see the dopamine molecule here. And in each of these figures, you can see that that's been highlighted where that exists in these compounds. So you can see mescaline is here, and then MDMA is here as well. But and then these are not psychedelics, but these are other dopaminergic drugs. Ketamine is a little bit more of an outlier in that it works differently. Its mechanism of action is different. It's also already FDA approved as an anesthetic. It's actively used that way right now in medicine, but if you give it at high enough doses, it does produce dissociative type events. And ketamine right now is actually very present, perhaps even the most present in terms of the commercial psychedelic landscape, because it is the only one right now in any form that people can get on the street. And so there's a lot of companies right now that are really pushing to make sure that it's defined as a psychedelic, because people are Googling that term and they want to come up, as well as, but it acts very differently.